Hi, this is Jerry Hesch at Hesch Institute in Aurora, Colorado. And we have a very interesting presentation. My client was injured in a car wreck, and he describes pain in the right wrist. And the car wreck was quite some time ago. When was it?
A year ago.
A year ago.
A year
Okay.
and 4 months almost.
A year and 4 months. All right. So you've been getting treatment,
Yes.
but they just haven't been able to effectively treat the wrist pain. Did they do x-rays to it?
I think so.
Okay.
so.
All righty. Although the pain, you described the pain as being in the wrist.
Yes.
Okay. Not in the hand, not here.
Sometimes it do tingling.
Some tingling.
Yes.
Okay.
Tingling and numbness before.
Okay, and numbness, and that comes from the shoulder down. So you do have a neck pathology they've identified,
Yes.
and they're treating, and I would think that those two would be connected. But what I'm pointing to is this pain in the wrist area.
Mm-hmm.
Okay. Do you feel like your wrist doesn't function normally?
Yes. At times it gets weak, so I cannot support myself if I try to.
Oh
sit.
yeah, you were showing me where you push down
Yes, like
with
to
that
stand
wrist
up.
and it feels weak.
Yes.
Very good. Okay. The wrist actually moves well in a glide, an upward and downward glide, a left and right glide. If I bend it all the way up, that's called extension, and I give it a little spring at the end, it's retained that normal joint mobility. So now I'm going to look higher than the wrist, okay? And when I test this movement of bringing your palm from being up to being down, it doesn't go all the way. And I try and do that little spring at the end of the motion, there is no spring. And then if I rotate the forearm this way so that the palm goes up, I can spring it at this point. Okay, now we're gonna also test, this is the radius bone. Can I pull it downward towards your thumb? No. Can I glide it up to your elbow? No. Now if we look at this one, and we look at this movement, you see it's not as much. This one moves more. In this direction, I'm going to suggest that the right one moves less. Okay, so this one I can get it all the way horizontal, not that one. And this one, when we rotate it palms down at the very end of motion, you have restored that spring. If I grab the radius, the long bone in one of the long bones in the forearm, it has that little bit of spring. Do you feel that little tiny give?
Yes.
And then if I compress up, it has that little bit of give. Okay? Very gentle test that I do. And so what's really unique about this is that most people who injure the forearm, and it makes a joint up here and a joint down here between the ulna and the radius, the typical injury can be, say, from repetitive trauma, such as supposing you were carrying a 5-gallon water, a bucket of water, which I do to water all the shrubs every month, you know, and your muscles fatigue, and then it just causes that bone to come downward and get stuck. That's a common injury. Yours is the opposite. Yours is with the radius jammed upward into the elbow. Okay. Another thing I can show you is there's a little bit of space between the end of the radius and the wrist. So if I come here, you feel me drop off that, okay? And I'm doing that on this side. Which one is deeper?
The right hand?
It feels to me like it's incredibly subtle. For some people, it's not subtle. And so if I come underneath here and butt up against the shelf there, That's a bad test, okay? I'm not getting lucid information, okay? So anyway, I want to treat it, okay? And what I'm going to do, well, I should have used this little guy. So here is an anatomical model. We have a joint here. We have this thick membrane called the interosseous membrane. At the top of it, we have a curvy joint on this bone, the ulna, and then we have a rounded head of the radius, and it rotates, okay? And it should have a little bit of up and down glide. That's a normal function of that joint, is you have a little bit of glide, you have a little bit of separation, a tiny, tiny amount, and a tiny bit of compression. If it was fully compressed already, it wouldn't rotate, okay? So I'm suggesting that this got pushed up. One other test, let's look at this movement, okay? So we're looking at this angle, okay? And I would call that about 20 degrees. And then we're gonna look at this one, and it's pretty subtle, so we're gonna throw that test away. Here's what I'm gonna do. I'm gonna pull this radius down. So what I do is I grab right here, so I'm stabilizing the upper arm, the humerus, and I'm clasping the radius very firmly, and then I'm pulling it down. I'm fairly aggressive here. His body's telling me it's cooperating. It's not fighting me. He's not demonstrating any discomfort. So I'm using about 35 to 40 pounds of traction on it. And you're a big, strong guy, so that's appropriate. So I'm gonna oscillate it, and it's now moving. So I'm gonna keep filming. I just need to answer the door. I'll be right back. Hi, I'll see you in the living room.
Okay.
I'm filming and I'll wrap up. Come on in.
Okay.
So the treatment is very simple. Did it work? Let's find out. So now we come this way, and now your hand, wrist is horizontal, and you feel that little spring at end range. And now, you feel that little bit of spring there? Mm-hmm. Okay? And then upward glide, that little tiny bit of spring. So now, how much does it rotate outward? Not as much as before. Do you see that? It's now horizontal, whereas before it was further. Okay? So this feels just a little bit, really subtle, but like a little bit more movement when I do this glide. Especially, I can see it more on the proximal carpal row, the proximal wrist bones. Can you lean on that hand now? Give me some feedback.
It's stronger now.
It feels stronger?
Stronger.
Okay. And that was painful before?
Yes.
And how much pain do you have now?
Much lesser.
Much less. Good. So when we restore movement in the joints,
I can have a grip now, like, yes, stronger.
Sweet. Well, I would submit that the nervous system was in a protective mode, and so it was inhibiting some muscle function. I should have tested your strength before and after. I just completely forgot. But you will find that your forearm is strong in the direction in which it favors movement, but coming out of that, it would be inhibited. So I regret not testing the strength, because we would have been able to demonstrate again. What I'm saying to you is over the next couple of weeks, it's going to continue to get stronger because it's no longer inhibiting movement because of the loss of those little micro movements. And, we could X-ray, CAT scan, MRI, and we wouldn't show those little tiny gradations of movement that it was missing. And people say, well, you can't prove that it was displaced. And I'm like, well, logic tells me it might have been displaced by a very minimal amount. And we could argue about that all day long. But nobody's done the gold standard of testing of orthopedic testing of joint motion, which is implant titanium balls and do a pre-test and then stress the joint, restore the movement, and then re-image it. It's called stereophotogrammetry. I don't believe it's been done. I'll look at the literature later on. But outside of that, no one can prove that there was a displacement. And people say, well, it's very subjective when you're feeling this, and that's very subjective. I'm like, yeah, of course it is. I've only been doing it 45 years. Okay, so I would submit that I have some skill set there. Anyway, we could argue till the cows come home, but you feel better. Do you notice?
Yes.
What does it feel like when you move it?
Like easy.
Yeah, and the nice thing about this work is it stays. You know, if you were to come back tomorrow, next week, a month from now, 3 months from now, it would still be restored per my prior experience. Okay, never say never, but I think I've yammered on enough. We're past 11 minutes. I'll stop talking.